Dame Anne, Matt Hancock told us this morning that he didn't quite know where we were, didn't quite know about the impact of the India variant. What are you making of it?
Well, I agree with him that we need more data, and this next week's going to be absolutely critical in obtaining that data. One of the things that we always have is after the opening up of a lockdown, there's always a delay between lifting restrictions and then the emergence of, as we might expect, more infection as people mix together more, and then whether or not that feeds through to severe disease and deaths. Now, what we have in addition to that mix is, of course, the arrival of this Delta variant, which we do understand is more transmissible. And we have seen in the last week or two a significant uptick in the number of cases from what was a very low base. And what we need to understand is what the risks are of that setting off another wave of infection, and also how well we can do in controlling it. So the data that come through in the next week are very important. And just to remind you that with the roadmap, one of the key ideas that we should always have a significant period of 5 weeks between each of the stages was to do exactly that, because of this difficult issue of the delay between opening up and then understanding the impact on transmission. But clearly, this new, more transmissible variant does create new challenges for us.
We have got some data, and we know that there is an uptick in infections, but we also know that hospitalizations are pretty much flat. Should we be more worried about the rise in infections or more reassured by the lack of an increase in hospitalizations?
Well, I think what is reassuring about the cases that we're seeing, if you look at the age distribution of them overall, we're seeing a much lower proportion in the highly vaccinated population, that is the over 70s. But we're seeing more infection in the younger population, particularly in young people, but also in those who are not vaccinated. Now, I've just said that it takes some time to feed through from infections into hospitalizations and deaths. Now, it is reassuring that we haven't seen yet an uptick in the number of admissions and deaths, but we are sort of 3 weeks now from the last opening up. And when you think about it, it takes a week for virus transmission to increase because the incubation period, and then it's often another week or two before people come into hospital after the infection. So we need to watch very carefully what the outcomes are. But we do know, of course, that the highest levels of protection are now, the 50% of people who now have had both doses are going to be in the more vulnerable group. So hopefully we'll see a continued unlinking. But we do need to think about the 50% who aren't fully vaccinated.
Damon, but is there a risk that the government could find itself in a hole here where it appears to have moved the goalposts? 6 months or a year ago, we were all worried about hospitalizations and deaths. It feels now as though the conversation is much more about but about infections. Is there a danger that what people will feel is we sacrificed, we stayed at home, we complied because we didn't want to overwhelm the NHS? We now know that's not going to happen, but now you've given us a new target, which is don't get infected, and we have to comply and stay at home for that. Is there a concern here that we might appear to be moving the goalposts?
I totally understand your concern. You know, in the end, we're going to have to, if you heard earlier from David Nabarro, live with this virus and try and minimise the amount of severe disease that it causes. But we've still got, I think, quite a lot more to gain from this virus, from the vaccination programme. We've still got quite a significant number of many more people, millions more people who can fully benefit from this vaccine. And I think that is the very difficult decision. We certainly don't want to go on delaying forever. It's going to be a very finely judged decision when we see these results. So one of the issues, of course, as you know, we are getting millions, probably about 3 million people getting their second dose each week, and another 3 million or so getting a second dose or a first dose each week. But as we know, there's a delay between getting the dose and being fully protected. So I think that's the very fine balance. The modelers in May showed you could set off, quite a third wave, and that is very dependent both on how transmissible the variant is and the fraction of people who are fully vaccinated.
So a third,
about all those things.
Sorry, so a third wave in your mind is still plausible?
Well, I think the size of, depends how you define a wave, and I think the model, this is, again, we have a lot of uncertainties, but the modelers looked at this back in May and there were concerns about this. I haven't seen the latest modelling because now we've got much more data about the vaccine uptake and the effectiveness and so on. So I think you have to consider that the vaccine does two things. It reduces the risk of disease and it reduces the risk of transmission. So you want to make sure that you're getting, using it as much as you can, and I think we've got a lot more benefit still to get from it as we continue to roll it out. And the big question really is the extent to which we see the extent of transmission with this new variant, and also whether it does translate into further admissions. Now, I think we're going to have to look at that very carefully in the coming week because of exactly the delays I've talked about and looked at the data, including the modelling, the newer modelling.